actually have, you have that computer, you have all your staff. I just,
I didn't say you didn't do it.
you're more Karen.
Karen is my editor.
Well, now we're getting a little bit more into that.
All right.
Yes, there are.
I was commissioner.
I remember coming to study sessions where we get coffee. I know, I didn't stop at all. I was trying to stop at one. That line of chance. And I didn't want
Our contacts are on here.
Oh, really?
So Mary Beth, what we've got in our board package is the Senate fiscal analysis.
Nancy?
No, I have a Randy. Yeah, I don't have a copy. He's good. I'm going to hand out the. You're good. Thank you.
What are you here for, Tom?
I'd like to call the Tuesday, December 7th study session to order, please. Madam Clerk, could you call the roll?
Yes, Mr. Chair. Commissioner Bear.
Present.
Commissioner Walls. Commissioner Kennedy.
Present.
Commissioner Duckham. Commissioner Pileski.
Here.
Commissioner Williams.
Present.
Commissioner Snell.
Here.
Chairman Shotwell.
Here.
8 present.
Thank you. We've arrived at the
7.
first opportunity.
7.
7 present. We've arrived for the first opportunity for public comment. Each individual will state their name and have 3 minutes to address the board. You may only address the board once under this public comment opportunity and may not yield your time to others. Board members will not debate or answer questions at this time. Public comment.
Good morning. My name is Ed Woods, and I am the current chair of the Mid-State Health Network, your PIHP for this region. The Mid-State Health Network covers 21 counties in the central Michigan area, and includes Jackson County. Our PIHP is about a $745 million operation. It covers SUD services as well as behavioral health services for the Medicaid population in those counties. I'm here today to support the vote on the resolution for maintaining local control of our community mental health system. Right now, I don't know if you guys realize it, but you folks are the most important cog, the most powerful entities in the community mental health system. You have the ability to recall board members. You have the ability to appoint board members. We have to come before you every 3 years to be reappointed and justify what we've done. And if our priorities, our strategic priorities don't align with the County Board of Commissioners, then you have a right to change us. And it has been known in this state on more than one occasion, and I can name names, of board members who were replaced until they actually went and replaced a director for community mental health. That's how important your position is. You don't answer to the governor, you don't answer to the feds, you don't answer to the Department of Health and Human Services. It's local. And with the changes that are going to be made to Section 203, it talks about throughout this, and this is exactly what it says, Section 203, throughout this chapter, a specially integrated plan is not responsible for the duties set forth in this chapter until after completion of successful transition under the Social Welfare Act. After the specially integrated plan has completed a successful transition, a specially integrated plan shall take over the duties set forth in this chapter, and the Community Mental Health Services Program shall no longer be responsible for those duties. Those Behavioral Health Accountability Council shall determine the successful transition. I don't know what the Accountability Council is. Determine the successful transition of each phase of integration, establishing when the specially integrated plan is responsible and the Community Mental Health Services Program is no longer responsible. So that, to me, right there is the crux of the matter, is that we lose local control, and we lose the oversight that you folks provide, and the accountability to the voters of the county of Jackson. So I appreciate your time. Thank you all. God bless you all. Thank you for your service to the citizens of the community of Jackson, and hope you have a happy holidays. Thank you.
Any other public comment?
Boy, I gotta talk fast. Good seeing everyone. Carl Rice, Leone Township. I'm a member of Lifeways Board of Directors, as well as first vice president of the Community Mental Health Association of Michigan. Yes, Commissioner Kennedy, I will be president at some point. We've had that conversation. Anyway, Mr. Chairman, if I will, if I could, can I submit this to the board, this document?
Aye.
Okay, well, let me get going here. I will provide you a brief summary of the document I just gave you. The information in the document is the facts from the Community Mental Health Association of Michigan, along with mental health leaders and professionals who have spent hundreds of hours putting this information together. What you'll find out is that Senate Bills 597 and 598 do not increase access to care. They do not increase providers, addresses, or does it address workforce shortages. Do not address the lack of sufficient inpatient care. Do not address or integrate care. They only integrate funding. Do not improve or guarantee better outcomes. 4 acronyms to help you out here, and myself actually. CCGP, Care, Cost, Governance, Performance. Very important. Care. The health plans are focused on contracts and money, not people. The bills do not focus on care. Cost. These proposals will lead to an overall reduction in services as the private health plans look to increase profit, not quality of life. Governance. The bills eliminate our local control, as Mr. Woods said. Your ability as commissioners to have a voice will be gone. Jackson County Board of Commissioners will have zero input with these insurance companies. And who is receiving services and who is not receiving services in our communities in Jackson County will not hear your voice either. Being able to represent a population of the most vulnerable will be gone. Performance. Health plans are responsible for Medicaid, mild, moderate, mental
10
health
seconds, Carl.
services. Okay. Well, let me my last point here then. I'm on the committee that's called Person Served Advisory Group. There are several people.
I'm sorry, sir, but your time's run up.
Okay,
Thank you.
couldn't get there faster next time. Thank you very much.
Any other public comment? Public comment is now closed. Approve the minutes of the study session for November, please.
So moved. Support.
We have a motion and support. Questions? Corrections? All in favor, please say aye.
Aye.
Motion carries. ARPA funding animal shelter. Mr. Overton.
We have the facilities directors and the animal shelter director up here today to discuss this.
Good morning. I'm here to talk about the ARPA funds for the animal shelter addition. In 2007, the county purchased the building that the shelter currently resides in, which is designed for a grooming and boarding facility. It's not really equipped for the type of business that we do there now and the volume of animals that we see. The animal shelter, this expansion project has been approved by the board previously, but due to funding constraints and escalating costs, we have had to put that plan on hold. So far, we've been able to save $1.2 million towards this project, and we're requesting an additional 1.5 of ARPA funds to be able to go ahead and start this project and see it to its completion.
Commissioner Pileski.
Thank you, Mr. Chair. We all love the animal shelter. As you know, I'm concerned to make sure that what we do spend our ARPA monies on are appropriate and are not going to be second-guessed by some federal bureaucrat years down the road. So under what rationale do we think this is going to qualify for ARPA?
Under Category C, the replaced lost revenue.
Which is the most broad
Correct.
category.
I'm sorry, I assumed everyone's on top
Well,
of
well,
that stuff,
to assume that I know something, Rick, is a dangerous proposition. So, okay, but the administration, you guys are satisfied that this is not going to be questioned at question reversed by some federal bureaucrat down the road?
I don't see how they could, Earl. It's a solid project, and as the board knows, because it's been in front of you all before, it's not an extravagant addition. It's just to make the shelter so it actually works as a shelter. As Lydia said, we've increased volume there of animals, gosh, probably fivefold since we opened the shelter in 2007. So now's the time to do this in terms of upgrading the HVAC systems, improving the ventilation of the building. That's going to be huge. And that's one of the main things that has been called out under the ARPA funding, is increasing and improving the ventilation. So we're on solid ground.
Just to supplement that, if I can, Cecilia, who is our expert in finance with regard to the ARPA funding, agrees that this would be approved under this category. So she's seen it and reviewed it and agrees.
Commissioner Snell.
Yeah, I'm one that believes that just because we can do a thing doesn't mean that we should do a thing. I'd like to know what kind of revenue we've lost. And I thought we were going to do a facilities audit and look at our needs there. And I think I'd rather see something that looks at our needs that are needs to be done first, like this building needed to have some work done on it. But I've gotten animals from the animal shelter, both Jackson County and Cascades over the years, and I think you guys do a fine job, but we need to be judicious in where we spend our money. And I read your report here. I guess I need a better understanding of what you do and why we need a $3 million expansion.
Thanks for the question. The current setup of the shelter really does not accommodate the needs for the staff or the animals in the building. We make do the best we can with what we have. We have no, like Rick was saying, the ventilation system is not adequate for the animals. Keeping consistent temperature has been an issue. Disease management is very challenging because of the layout of the building. There's multiple reasons, and as far as the staff goes, wanting to have a place that county employees can actually go to work. We don't have any break room. We don't have restrooms for the team. We don't have any offices. It's, for the staff and the animals, and for the public coming in, it's really not set up ideally. I welcome you to come and, kind of walk through, and I think it helps to see the layout. We do the best that we can, and as far as we have no storage space either. So it makes it really challenging when we also have to abide by certain state guidelines that are very difficult for us to meet those guidelines in the current building that we have. So, and the addition is not anything, no Taj Mahal or anything that's going to be glorious. It's going to be basically just getting this building up to, what the standard should be for an animal shelter in the state of Michigan.
If I can add a little bit, I think it is important to actually have a visual and see how the animal shelter operates. One of the things that we consistently get tagged on our annual audit from the state of Michigan is for the ventilation and airflow. And because we have such poor ventilation and airflow, we're starting to experience some internal issues as well, where the paint is falling from the ceiling because of the improper airflow in the large dog room. So we're starting to experience, because we don't have a proper facility for what's happening there and the amount of animals that we are having come through there, we are starting to experience some not only internal physical building issues, but external as well. So you go in there at any time and they're packed. I mean, there's no accommodations for the public. Everybody kind of groups in the front lobby, which is small. So based on the operations that we have right now, the facility isn't doing the best that we could to serve our public and to serve the animals and our staff, which I think is also important.
Thank you. Excuse me. So and I guess this question is more for administration. So the project, again, is roughly going to cost $3 million. In our reporting back to the feds, are we going to have to prove that there was a $3 million shortage in order for this to be approved?
Well, first, to be clear in regard to lost revenue, that lost revenue was from, the COVID period. And it was like almost $7 million total. That money is the money's that's most flexible. We can do what we wish with that money, because it was frankly money that we lost due to COVID. Here, what we had done in the past, this has been to the board before. The board, at least my memory says, they approved the construction, did they not?
Yes, that is correct.
We had the architect design the structure, the addition. We've done all that. But when we went to bid to build, it was more money. The cost had gone up such that we did not have the cash on hand to do it. And we didn't really want to borrow money. We wanted to spend our existing cash. So we've been saving money. And you have saved up thus far 1.2 million is what they've saved from their proceeds. With this here, we had an opportunity. We're like, okay, we don't think costs are going to come back down. Because part of it was like, well, maybe costs will come back down. But now we're kind of like, well, no, it doesn't look like that's going to happen. And it takes a long time to save that much money from that little operation. So we're like, okay, we have this money available. We have the flexibility to spend it any way we see fit. We believe that this is a necessary expenditure. It's only a matter of time when we're going to do it. And I concur with everything they've said. I've been there multiple times. There are no offices there. I mean, literally everything is consumed with either a place to store, pet food or, really it's cages and such. We have 3 animal control officers who have to basically work out of their vehicle. And there's no place to meet with customers or complaints or issues. It is a struggle. There's not even a place for employees to secure their personal belongings like a purse when they come to work in that building. It wasn't originally designed as an animal shelter. We purchased it in like 2007, I think, or 2006, and did the best we could at that time to modify it with the resources we had available, which were minimal. And we've limped along, but as has been stated, the growth has been tremendous. We have more employees out there trying to take care of those animals, and frankly, talking about running a tight ship, they're one of the only departments that run mostly on volunteers, and just having someone who can coordinate and train volunteers is practically a full-time job. So I think it's money well spent, and that it's long overdue to make these modifications
So
to the
I
animal
don't doubt
shelter.
that the building needs repairs. But I just want to make sure that, again, we don't have to prove that we fell short of $3 million to spend $3 million of the ARPA funds.
Well, first, we won't spend $3 million of ARPA money. I think it's like 1.5 or 6 million of, thank you.
So we don't have to prove that that money was lost.
No,
Okay.
no. And frankly, we already have proved that money is lost. We did that with our budget last year. That's why we were able to categorize that money as lost revenues.
So is that and I'm sorry for all the questions, I just want to make sure I
No,
understand.
go ahead.
So is that specifically for general funds, or is that solely for lost funds as it relates to the
No,
animal
the lost revenues they have the most flexibility. It would be just as if it were general fund dollars. You can use it as you see fit.
Okay. I just wanted to be clear. Thank you.
And we will have additional lost revenue this next year as we have to redo the calculation. Pretty straightforward calculation, too. How much money do you have in 19 and how much did you get in 20? What's the difference? That kind of thing.
Thank you, Mr. Chair. I have nothing further.
Good morning. Going through your report, Section 2D, with the growth of the shelter over the past several years, we've seen an increase in large quantities of animals being brought in at one time due to neglect, abuse, or hoarding situations. I'd like to know your numbers. What numbers of animals are brought in at one time because of neglect, abuse, or hoarding? And what numbers of large quantities of animals are being brought in when we import them from other states? Can you give me those large quantities?
I don't have all the numbers in front of me, obviously, but I can, for example, animal control brought in 43 cats from one resident just a couple of months ago. Currently, right now, animal control is bringing in 16 cats from one residence where the person was found deceased. There's multiple cases like that where that's something we not planned for, but we have to respond in those situations. So those would be some examples of just, happening right now, that we would bring in a large amount of animals at one time.
Okay, so that's the local causes. What's the number of animals that are imported in one large group from other states?
The number you said?
Yeah, how many animals
It
at
just
one time?
It just depends. It can be anywhere from 8 to 45. But those animals typically have been adopted like the same day or the next day if there's, they don't stay in the shelter.
All right, but we still need housing for them while they are there.
Absolutely.
Whether it's a long stay or a short stay. Okay,
Yes.
so the local causes and the importing from other states are both about the same number. of large quantities of animals being brought in at one time.
Right, I think last year we had a case where we had, I think it was 40-some dogs that we had from one property that came in, and that was a court case, so that held up space for quite a long time. And in November, we had 130 turtles, which took up our whole entire puppy room for over a week. So,
Okay.
If I may chime in on that, just briefly, sir. In the past, for years, we did not have animal control officers. So we have 3 full-time animal control officers once we got the millage and can afford that. So we're actively pursuing cases. In the past, when we didn't have animal control officers, it would be on a hit-or-miss basis. Somebody would complain about their neighbor, a law enforcement officer would stop over. Oh, lo and behold, they got 50 animals or something. But it's more common today than in the past because, frankly, we have people pursuing those kind of activities out there. And as far as the animals that are coming in from out of state, that's by choice. Those animals do not have to come in.
correct.
They're coming in because we don't have enough puppies, and you're bringing in puppies and adopting them out.
Yep, or dogs that are different breeds than what we currently have. And we use the funds from the animals that come in to reduce the price of our Jackson County animals to help, incentivize to move those animals into homes.
Right. I was going to say, the animals coming in from out of state actually are a great benefit to not only our community, but to our organization.
Definitely.
Thank you.
Well, those animals coming in from other states are also part of the problem of large quantities of animals being brought in at one time. That
Can I
can't be
interrupt?
done.
Those animals are only come if we have space for them. If we're out of animals, then we'll accept, because we have times where we do run out of animals for adoption, and we don't want people to stop looking to adopt. So we want to make sure that we have animals available for those looking to adopt. So when we run out of animals, that's when we'll bring animals in for adoption.
Your costs here, you've got the animal shelter fund balance of $1.25 million. You got the proposed cost of construction at $2.8 million. So you're asking for $1.55 million. Your total project cost is $3 million. What you're asking for doesn't include the heating, ventilating, air conditioning component. Where will the funding for that air conditioning component come from? And when will that happen?
That's actually part of the ARPA plan that was presented to the commission, and it will come once we go out to bid. If our whole purpose in presenting this is permission to go out to bid. At that point in time is when we want to get the best ventilation system in there that we could, and that's why those funds were separate.
Well, if I may add to that, part of the reason they're separate is they're different categories of funding. The ARPA monies, was it category A? Is it C or A? I don't remember what that is.
A is for the improved ventilation.
HVAC, okay. So under the category A monies, HVAC, ventilation was a big thing with COVID. They determined that if we could move the air more and that sort of thing, indoor air, we're safer, we're less likely to contract COVID. So we separated that HVAC quote for this project because it fits into the larger category of HVAC that we're going to do across the whole county of all our buildings. That's the only reason that they separated that out.
All right, so this $1.55 million that you're asking isn't the end of your asking to finish this project. You're going to be coming back asking for category A money to do the HVAC systems.
Yes.
Okay. I guess my preference would have been to ask for everything you need. Just state that this much comes from category C, this much comes from category A, have it done in one approval. But if you prefer to break it up, okay. We just know that an additional request is coming. Pardon me?
It does say that in the staff report that we were going to bring the additional request for HVAC in there,
Yep.
just to be clear.
the floor plan quite a bit. I see where the reception area is, where when I brought animals in, I've gone to that reception desk and had things processed. But then way around the other side of the building is the cat intake and the dog intake. People are just going to come into reception, then go through the building to the opposite side and intake their animals over there?
The side where the dog intake and cat intake are, there's going to be, that's going to be the actual entrance for intake of animals. The entrance that we currently have will only be the adoption side, where that's where people will leave with animals. So we're not cross-contaminating animals coming in off the street that maybe have any kind of disease, mixing with our animals that have already been vaccinated and vetted and leaving the building.
So if someone has a dog that they can just no longer care for, how will they know which entrance to use?
We'll provide signage outside the building for animal intake and animal adoption.
All right. One last question on your plan. What is the Rainbow Room?
We offer owner-requested euthanasia, and it's commonly known as going over the Rainbow Bridge when people lose a pet. So we were going to, that's going to be the room designated for euthanasia. Right now, when people request owner euthanasia, it's done on top of a freezer in our dog intake area, which is not super comforting for the public way for them to come in. We're going to make a room that's designated for owner-requested euthanasia, so it's a little bit more comforting for the public to come in.
Okay, thank you.
Corey?
Yep, I'll be brief. Thanks for the presentation, and I think obviously these are long-needed things, or not long-needed, but they're needed. My question's more to the administration. You had mentioned you easily can show a $7 million revenue loss. Were you specifically referring to this department? No. Okay, so my second...
That's the whole county.
I got you. How, I would like to see, if possible, the amount of revenue that the animal shelter lost in that year. I know it's funded by a millage primarily, but I also know you did a great job in finding sources of revenue to do that. I'd like to see that concrete number, because I have similar concerns to Commissioner Williams, that down the road, a bureaucrat gets in there and says, we want to see exactly how much revenue was lost per department. And I understand, Mike and Deborah, you're the experts and you did lots of studying, but I'd still like to see what the exact revenue loss was for this specific department, if at all possible. Is that available in the budget and I missed it?
You know, we have to speak with Cecilia. Cecilia did the calculation for all that. I'm sure she can easily show right where the revenues were all lost from. I don't recall you guys having a revenue loss at all in their department. But that has little bearing at all on how we use the money. The ARPA allows us to use our revenue loss any way the board would see fit.
Okay, thank you.
Further commissioner questions?
Mr. Chair,
Yes?
real quick, just as it relates to the HVAC system, I was curious. I didn't see it in here, and if you put it in here and I missed it, I apologize. But I was just wondering if, with the additions there, if that system has an air purifier or within it at all.
How that's set up is, it's a rapid exchange of air.
Oh, okay, gotcha.
Yeah, it's the same principle that we used for the cat room. We're just pumping air in and out of there, and it really has decreased the amount of airborne infections in that room.
I was just curious.
No.
Thank you, Mr. Chair. Nothing further.
Any other questions? Well, thank you. I look forward to this. This is going to committee, correct, Mike? Yeah, so we can ask more questions then. Make it more fun, Rick. I want to thank you guys for your hard work out there too and due diligence, and the community really appreciates the effort you put forward.
Yep.
And our household is very happy with where we're at, so thank you very much.
Thank you, I appreciate you.
Yep.
We're gonna stay here, don't we?
Yeah.
I guess you get to take over the next one, Rick.
Yeah, we're going to talk about the exciting topic of replacing old elevators. As we've reported before, we've identified 4 elevators that are in sore need of modernization. 2 of which are here at the Tower Building. One's right back there. That's both original to 1929. It's all 1929 equipment. It's certainly been a challenge keeping them running. It's a lot of times now with these antique elevators, it's a situation where the parts have to be manufactured, which takes quite a while, or in the case of our back elevator here, we also have water infiltration at the bottom of the elevator shaft that needs to be dealt with. At our Human Services building, the elevator there, it's a freight elevator. It's been in use since it was a medical care facility. It's used multiple times a day by the Department on Aging for bringing the food from the freezers and coolers down on the garden level up to the first floor. It's also used by emergency management when they receive large shipments of PPE, things of that nature. It's being taken up to the second floor. This is an elevator that's original to the building. It's become problematic with controls. The elevator at the North Lawn building for the friend of the court and the prosecutor's office, same thing. It was installed sometime in the 60s. It's the same type of issue. It's never been modernized. So the first step forward in this process is getting a consultant engineer on board to go through and assess the needs of each elevator. Here, it could be complete. Take everything out, put all new in. At Human Services, at friend of the court, it could just be a matter of going in and replacing key components with new components that will operate a lot better. And as such, I'm asking that we use these folks from Holt, National Elevator Consultant, to do just that. They'll go through, they'll assess all the equipment, they'll decide and recommend what they think we should replace and what we can retain. So that's about it in a nutshell.
Got your mic on, Rodney?
From what I could tell, they are an independent company. The guy who bought it spent 10 years as a supervisor of elevators and electronics for Michigan State University, which is one of the things that drew me to these folks, because at MSU they have old buildings, kind of old buildings, and brand new buildings.
Okay, good. Thank you.
Go ahead, Tony.
Hi, Rick.
Sir?
This company, NEC, was selected. Was there a bid process? Were there other bidders? How did you choose NEC?
No, this is a single source. I chose them because of their location. I didn't want to have a company coming out of Detroit or out of Grand Rapids, because every time they come here, the cost increases. When we did our elevators at the courthouse and here at the Tower Building, we used a consultant from Lansing who ended up retiring. But it was extremely easy for them just to roll down 127 and get here.
Okay. I like that answer. Other question, you say this $46,000 contract is just for the assessment?
No, it's to take it all the way across the finish line.
All right, so you said the first step was the assessment. So after NEC performs a feasibility study, from that study, a budget's going to be developed, and as part of this, they're going to write the specification of the bidding documents.
Yes. And
What
then,
review or input do we have at the end of their feasibility study before they take it into contract documents?
well, for my department, it would be reviewing what they're recommending and moving forward from there. That's
Okay,
just
so
what we would do.
your intent is that you and your department will review the feasibility study and then direct NEC to proceed to the bidding documents?
Correct.
Okay. All right, that's all my questions. Thank you.
Anyone else? Okay,
Thank you, folks.
thank you. Item C, request for ARPA funding approval for IT project number 15.
Good morning. So today we have our IT project number 15. This is for a centralized county-wide security camera solution. We went with a local vendor, Challenger LLC, to quote out this work because they already work for us and they already have some existing systems in place. This will be centralized to the entire county, which will be an improvement to help with public safety, also to help with keeping our public safe. Oldest system is at the front of the courts, and we take care of kiddos out there. A lot of these cameras are also watching money that's being transferred, for example, the Treasurer's Department, and they are end of life, out of support, and need to be replaced. There's two different options that we've presented to you. One is for a cloud-based, the other one is for an on-prem. The recommendation that I would put forth is for the cloud-based surveillance system.
If I may chime in.
Yes.
A lot of our cameras, guys, obviously are old, not the latest technology. I find it somewhat infuriating at times when we'll have a crime committed around one of our buildings and we see the person we see the person on the camera, on the screen, breaking the window or doing what they're doing, but we can't identify them because of the poor quality of the video itself. If we're going to use video cameras, we should use ones that allow us to actually do something about it, if you will. And then one other thing I would point out, a lot of our cameras, like the ones on the front, they're self-contained. They're a camera with their own even little memory card that you got to go pull out or something to stick in your machine. What she's talking about is something that's all integrated into a server and cloud-based that you can just pull up on your system regardless of where you are at the time too. So it's a much improved product.
Additionally, the other thing I would like to add too is if we go with the cloud base, it also has a monitoring system, so it can trigger security alarms or whatnot if there's presences in buildings outside of operational hours or something like that. It will help us also with security.
So if a commissioner comes in to go to the 5th floor, you'll know?
We could. It depends on which one. No, I'm kidding. No, honestly, you could set the hours. If this room would be one that we would want to secure from an 8 to 5 or whatever hour, yes, we could do that.
For what it's worth, we know that now because the elevator swipe cards can record everything, as do all our doors.
But originally we couldn't.
Correct.
We learned that the hard way.
Yes.
So, okay.
Keep improving.
Questions, commissioners? Tony?
Good morning. That's a good question. In between the time that Challenger had done their on-prem site audit walkthrough, there was some requests at the district court and some other buildings that had asked if we could fine tune and add some more cameras where there was some blind spots in.
Okay, so even though Intercomp is providing more cameras, their price is still better.
Correct.
All right. In the Intercomp price quote, down below line 21, cabling provided and installed by the County Facilities Group. So our County Facilities Group is going to pay for the cabling and going to install the cabling.
Typically, sorry.
Do we have a cost associated with that? And does the Facilities Group have time to really do that for 249 cameras?
That's a great question. Typically, the IT department covers the cost of the cable to run. The facilities team runs the cable because they're familiar with the buildings internally. I think because it's not something that we need to rush through, that we can make the time and work with the facilities team schedule to get that done. A lot of the cabling is already existing in place because a lot of these are going to replace cameras that are already existing that have cable. So it won't be such a burden because the new cameras will be the ones that need to have cable runs. Not all of them.
Okay, so the labor for facility staff and whatever amount of additional cabling, that's going to be paid for through what source?
I could cover, there's extra room in the budget that we get put here for the surveillance cameras that we could cover, but I could cover the cables within an IT budget that we already have a line item for.
Okay, so then rather than asking ARPA funding for our facilities labor and your materials, you're not requesting ARPA funding for that, it's just coming from the taxpayers.
I wouldn't say that it's coming from the taxpayers. We would ask facilities to do this kind of work anyway between cooperation between the departments. It's not anything I think that's extraordinary in taking time away from the other projects that they're going to do. Internal services work together to use the taxpayers' money, so I think that it falls in line, and specifically if we pay for the cable, it's just something that the facilities team would do as part of their work.
Thank you.
You're welcome.
Yeah, I was just going to say that is routine. It's an opportunity cost, obviously, because something else is not getting done while they're doing that. But at the same time, to contract that out, not only is pricey, but the greater concern on our part is we have a lot of buildings that are very old and that have had lots of modifications, and they're not all as-built drawings, as you know, and you know what that means. Outside vendors can easily mess things up by trying to do things where they think there shouldn't be anything, but Rick and his crew have been around long enough to know that where some of the pitfalls reside. But I think it's a good plan that way.
Yeah.
Thank you.
I would prefer internal do it as well.
It's safer.
Tony?
One last question, if I may. Usually there's a proposed motion attached with these. We're not going to make that motion today, I don't think. When this is brought back to us on your page 1, I personally would like to see this motion changed slightly. Motion to approve ARPA funding for a countywide centralized security system. I would like to have that changed to motion to approve funding for a cloud-based solution, since you evaluated two, a cloud-based solution, countywide centralized security camera solution provided by Challenger LLC with a project cost of, I would like to see the cloud-based in there, and I personally like to always see who it is we're contracting with listed in the motion.
Sure, I can do that. And then for further clarity on that, would also like to say Challenger will do the work either way. The Intercomp is actually where we'll get the cameras from for the web-based solution. So my pleasure to update that for the next time. Thank you for that.
Okay.
And if I may, just one more quick note, and just to remind everybody that in all of our monies for ARPA, regardless of amount, And I say amount because obviously various amounts, if it's less than 75, it can be approved at committee and all that sort of thing. We had set a policy early on with the ARPA funds that we were very much all about transparency. Every dollar we spend from ARPA funds will go through the study session, the committee process, and then the Tuesday night process. So there will all be 3 opportunities before the board would ask, or before we would ask the board to actually approve or disapprove of an item. Thank you.
Thank you.
You're welcome. Have a good day, everyone.
Public behavioral health legislation. That you guys
Have up first, yes, I believe that's correct. Thank you.
Michigan Association of Health Plans.
Thank you. Good morning, Chairman Shotwell and Commissioners. My name is Christine Shearer. I am Deputy Director of Legislation and Advocacy for the Michigan Association of Health Plans. With me today is Brian Mills. He is Deputy Director over the Commercial Market and Communication. We appreciate the invite here today to talk to you about these 2 bills on this very important issue. I believe we had some slides. I'm just going to I'm going to go quickly through these, and I'd assume that mostly we have some questions and answer sections. So the Michigan Association of Health Plans is a nonprofit organization. We represent 10 health plans covering over 3.2 million Michigan citizens in the Medicaid, Medicare, and commercial product lines. We also have 34 business affiliates. Our members collect data and support evidence-based medicine with facilitating disease management and care coordination. One of the slides has all of our members and what product lines they produce. We believe that Senate Bill 597 and 598 would provide greater access to care, consumer choice, and better transparency and ensure quality outcomes. 68% of adults nationally that have a chronic physical health illness also have a mental health illness. So that's 1 in 5. We believe the current system is currently not working in the last 5 years. 9 out of the 10 PIHPs have been underwater, fiscally underwater, at the cost of $93 million GF to the state and taxpayers. We believe a true integrated system is better, where you take your physical health with your mental health. Currently, all of us are blessed with employee-sponsored health plans or state-sponsored health plans, where if you have a mental issue, you go to your primary care. So, example with me, 4 or 5 years ago, went in for my annual exam, was talking to my doc, everything checked out. She goes, "I have to say, Christine, you look really tired." I had black circles, and I said, "Yeah," I wasn't going to say anything. I don't know if it's the menopause that I've been going through and not sleeping, or that it's my dad that passed 3 months. And she goes, "Well, now that I see you are on a low statin and a low blood pressure medicine, I don't want to put you on Zoloft. Maybe we should try some Wellbutrin. And with that, how about a couple months of talk therapy to get you over this?" That is how we all handle our mental health. And we shouldn't be treating people differently, we believe, and you should have one card, 1-800 number, and one place to go. We don't believe that these bills will solve everything. We have a provider shortage throughout the state, throughout the nation, and there are HARPA dollars in the supplemental to hopefully address that, looking at telehealth and some other things as well on that. One of the slides, yes, is our current system and the new system. It would be taking out eventually the PIHPs. So we have very high administrative load currently on our mental health system, and this would be removing some of that administrative services. The next 3 or 4 slides, this is where it's very confusing. DHHS had to provide this to our CMHs and ourselves of who's responsible for what. There's a lot of finger pointing that goes on, and people are falling through the cracks on these. 33 states have passed some form of integration, true integration. 28 states have full integration with their physical health and mental health. 15 states have a partial or phased-in integration, and then 9 states are still fee-for-service. That does add up to 52, and that includes Puerto Rico and D.C. Let's see. We also have, these are also the slides, and the SAMHSA slides on who is responsible for what not. Brian, did you want to do this?
Real quickly, and thank you, Commissioners, for being here. If we could just jump to the 2 slides, I just want to give a visual explanation. You're going to hear a lot of terms between health plans and CMHs today that are going to make you scratch your head and say, what the heck is integration? So we're trying to boil this down to 2 slides. So the first slide that you saw earlier had the consumer split right down the middle, right? Remember when we talked about how a commercial customer, when you go to your insurance company, whether it's physical or mental needs, you go to one-stop shopping. Unfortunately for Medicaid patients in Michigan, that's not the case. It's a bifurcated system. So when they need physical health, they go to their health plan. And when they need severe mental health, they go to the current state government-run system where you have a PHIP and a CMH that you are all most familiar with. That's the current bifurcated system. It's not like the commercial market. This slide is an illustration of what it's like in the commercial market and what it would be like under Senate Bill 597 and 598. And this is an explanation of how it would work. Essentially, the department would put out a bid. Various entities from around the state would bid on providing integrated care for Medicaid patients, all in one, all encompassing. The department would pick eligible entities and say, you have a qualified plan that a Medicaid patient can use for integrated care. And then the consumer would do the shopping. The consumer would pick which plan is best for them for their integrated care. So that's sort of an illustration of what it would look like under these bills if they're passed.
Also, in the current system, you have to stay within the county of origin. This would allow you to go wherever the services are needed and required, and the best provider to provide those services for your individual. So that's kind of where we are. We're more than happy to answer any questions you have on the Senate bills. Again, they are currently on the Senate floor. There will be an S3. There is, as I said, also a supplemental, which is Senate Bill 714, which currently has $348 million, most of it HARPA, except $15 million of that going to eliminate what I'm going to call the QAP. It's a quality assurance assessment, but how the counties had to give some money back and then, they filtered it through. So that will be made whole there, but again, there's a lot of jail diversion dollars in there, crisis mobilization units, expansion of beds and services throughout the state, child advocacy centers are included, and whatnot. So again, from the S1 to the S2, and again, there will be an S3 on the floor. They moved from a 3-phase to a 4-phase. So you will start out with children who are severely emotionally disabled and mentally ill. That will be the first phase. Every phase is a 2-year phase. This is kind of what Arizona, Texas, Kansas, New York, and other states have done. And then at the 18-month mark, there will be a third-party entity that does a study This will be on outcome measures that we've improved, that there's not a circular door going back into the emergency rooms, that people are staying on their meds, that they're attending their job, they are getting the assistance that they need. Also, there will be patient, guardian, and parent satisfactions that will be looked at. This will happen at 18 months of each phase. At the 2-year mark of the end of the phase, we have what are kind of called off-ramps that will be looked at by, there are 2 councils in the bills, and they, in the S2, have beefed up those members on those council, added people to that. And if we haven't met the mark, if the SIP hasn't met the mark, you could either extend the contract, hold on to it, or there will be an off-ramp that, you know what, we aren't going to move to the next phase until we get that whatnot. Again, the CMHs are a vital member and partner with the SIPs. They are not going away. They will never go away. You have a great CMH here in the County of Jackson, and I think they work pretty well with our members. I have not heard any concerns with that. Again, we will be using them as a provider. However, these Senate bills also allow us to contract with other providers. So for crisis management, for telehealth, to get services and access that people need in a timely fashion. I don't know if anyone has any questions.
Then Tony?
Thank you, Mr. Chair, and thank you for bringing this information to us. I've got 2 or 3 comments to make. One is with respect to administrative costs. You've made a note with respect to administrative costs, which I think also the CMHs are making reference to. In other words, the other guys have higher administrative costs than we do. So you're making that representation. The CMHs will make an opposite representation. And I simply note that in the Senate fiscal analysis, the observation of the analyst was, we don't think anybody's comparing apples and oranges, and we really don't know what's going on with administrative costs. So I simply note that as a question that hasn't been answered by, I don't think, anybody in this whole process. And if cost savings is the object of the bills, I'm concerned about that, because my object would be to see that those who need services get them, and get them well, and if we're going to make a change in the system, that they get them better than what they're getting now. So the costs, yeah, there's going to be a lot of talk about that, but my concern will be, how well are people being served, okay?
Yes, we believe there are 3 stools to this chair, 3 legs to the stool, excuse me, and one is financial, but the most critical is the clinical. And again, we share no information. The CMHs and PIHPs share no clinical information with the medical physician, i.e., in my example, my doc knew the physical drugs I was on. We don't get that information now, and there are some tremendous side effects, and mostly on the physical health side with those behavioral health drugs. We believe there will be savings over time, not at the beginning, and we believe that will take place on the physical health side. You will go into the hospital because you aren't taking your diabetes medication, not because you didn't take your schizophrenic medication. So we will see that savings on the physical health side. They have put in statute that any and all savings will go back to the mental health side. The health plans currently in their contracts with the state have to have a medical loss ratio, meaning all of our capitated payments have to go, 85 to 90% have to go to serve the patient, the consumer. That is not the case, in my understanding, with the PIHPs and the CMHs. There was a study nationally done. However, as you know, as a former representative, the health plans pass through a lot of dollars to other entities. So our administration is around 8%. annually. There's just this last year, the report came out, is about 8%. But some of the services that we provide that is considered administration that doesn't go to actually the patient is transportation is one. So it's those kind of, and self-determinants of health. So if we go into someone's home and see they need a ramp, or why they aren't adhering to their drugs, it's because, their refrigerator isn't working, or they can't get to those are the kind of things that we also provide, and it is not just financial savings.
If I might continue, Mr. Chair, with respect to our local community mental health agency, which is excellent, as you note, thank you for that. I guess I've got two questions. Could a community mental health agency be a SIP under the bills? And even if it wasn't a SIP, what would be what would our community mental health agency do in the mental health realm if these bills were to be passed?
Can you unstir your alphabet and tell me what a SIF is, please?
A SIP, go ahead.
Specialized Independent Program. That's what they're creating in the Senate bills. Also, the governor and the previous Director Gordon started with SIPs. The PIHPs and the CMHs could be SIPs. However, they need to meet the criteria of the insurance code and have the risk-based capital that the health plans have to ensure that they could pay premiums. I think it's 3 to 6 months. They have to have capital on that. So that may be difficult for some of the CMHs, but they could also partner with the health plan to become a SIP. I guess the bottom line is we need one entity responsible and one place to go. With the SIPs, you also get the PRIRA, so the DIFs, the Department of Insurance and Financial Services, a lot of acronyms, I apologize, but you get PRIRA, which is the Patient Right to Independent Review. So if you are denied a service or a treatment, you can go either to the Medicaid Tribunal, you could go to recipient rights, and you could also go to PRIRA. So that is, I think, a huge bonus, as well as having choice of who your provider is. If folks want to stay with their CMH, they can stay with their CMH. And again, the health plans have to contract with all CMHs in the area.
Tony?
Good morning. The last slide you looked at, or the slide, tomorrow's integrated delivery network. Health plans and PIHPs compete to provide plan choices for consumers. And the gentleman said these were qualified entities. What are these qualified entities? Insurance companies?
Yeah, it would be the SIP, the Specialized Independent Programs. The department will create an RFP and bid those out and then have the qualifications in there. So it's called a Specialized Independent Program.
Okay. And you said these are your members, meaning this is a group that all these different health plans have joined?
No, these will be separate entities, so I don't know which of our members will bid, but example, Meridian Health Plan, Molina Health Plan, and there will be a separate contract from their physical Medicaid health plan.
Okay, so the member health plans, are these what, like Jackson County could enroll in these health plans and offer this to our staff?
No, this would be for Medicaid eligible folks only.
So individuals would sign up for this individually through Medicaid? Okay, so they have
currently on the physical health market, you have a choice. When you become eligible for Medicaid, they will give you a list of providers in your area. We have at least mandatory, have to have 2 providers per region. There are 10 regions in the state. There's a waiver for the Upper Peninsula, where you just have the Upper Peninsula Health Plan. So you can choose, and you usually look on, where, Dr. Shotwell is. If he's my physician, then I make sure that he's in the network of that health plan, and that I still get to go.
Okay, so the individual through Medicaid would have to sign up through their specific region.
No, I'm sorry. There is going to be two plans available throughout the state, except the Upper Peninsula.
So an individual on Medicaid choosing to sign up for one of these has 2 plans in the Lower Peninsula to sign up for. 2 options.
At least 2 plans. We don't know how many will be awarded the contract. I'm sorry, Commissioner, if I'm not being real clear. So you will at least have 2 choices.
All right, well, just getting back to you, you're saying this improves consumer choice. You'll have to explain to me, how do consumers have additional choices under this plan as to what they have currently?
Currently, right. So let's just take behavioral health as we know it under Medicaid.
Take the
right,
what?
Behavioral health or mental health under Medicaid. Right now, the consumer has no choice. They do no shopping. They have to receive the services through the county/CMH, PIHPs. It's there. It's dedicated. They have to use that. On their physical health, the Medicaid patient gets a list from DHHS, and they pick one of many health plans. And they say, I want to go with Priority. I want to go with Blue Cross Blue Shield Complete. I want to go with Molina Health. They have a choice. And they can change that in the future. But when it comes to behavioral health, the Medicaid patient has to use the current system. Now, we're not here to say that that's bad, right? You have a great CMH. All we're saying is they should have the same opportunity to choose for their behavioral mental health like they do for their physical health. So under these bills, under that visual, the new law would say there has to be at least 2 eligible entities, 2 health plans, 2 PHIPs, 2 entities to provide integrated care. And they would pick from it the same way they do with their physical health.
So a person who is unemployed, for whatever reason, they often don't have physical health plans because they often can't afford them. So that's why they use the Medicaid.
Sure, but
so I don't see that they have much of a choice for their health care. And
your current Medicaid patient has many choices for their health care. They're on Medicaid, but the days of straight Medicaid, fee-for-service models, those are antiquated. Now, when an individual is Medicaid eligible, they pick from many different health plans to choose the coverage that they want. That's how it's structured today.
And currently, it's structured so that for their mental health, they have to go to the county
Correct.
mental health facility.
Correct. Yep. For severe mental health conditions, correct. Absolutely correct. So for consistency, integration, cooperation, having the same ability to choose for their mental health as they do for their physical is the intent behind this legislation.
Well, then, you're assuming that the person who has, I believe you said, severe mental health issues, you're assuming that with those severe mental health issues, they have the capacity to make a good choice.
Certainly. We believe that.
And if folks don't make a choice, there's an automated system that folks will automatically be enrolled. And again, they can change within the first 90 days and then every year after. So an automated system, meaning if I am eligible for Medicaid and I don't choose within the first 3 months, I don't choose a provider, I don't choose the health plan, the department or DHHS will auto-assign me for my location to one of the health plans in that area. So that's how that works. And that automated assignment has
It goes on quality, and it constantly changes. So it's quality outcome measure, so the best plan at that particular time would get that enrollee.
All right. With the current situation, the Board of Commissioners has oversight over the county mental health activities. Under this proposed plan, what oversight would the county have? Zero?
You would continue to oversee your CMH. There's nothing that removes county-level jurisdiction over your CMH.
Over what? Could you speak up, please?
There's nothing in the legislation that would remove county oversight over your CMH. You still would have the same level of oversight under CMHs. And if CMHs are not an entity that bids and becomes a SIP, and let's say it is a health plan that becomes the SIP, they're forced to contract with the CMHs and utilize them for services as prescribed in the statute. So you'd continue to have the same level of oversight.
All right, thank you.
Commissioner Snell.
Thank you, Mr. Chairman. I've worked as a board member for Lifeways, and I've also worked in the trenches in care homes. And I got to tell you, many of these individuals are not making their own decisions. They are not making the decision on what provider they're going to. They have people who are making those decisions for them. To try to say otherwise is kind of, in my opinion, disingenuous. But somebody will be making those changes and making those decisions. But many times it won't be the person getting those services. It's been my experience, and I didn't know that there was this wall that the mental health doesn't talk to the physician side for physical health. I remember taking clients or consumers to doctor's offices. I don't know how one didn't know what the other one was doing.
Thank you. Great question. I too, myself, was a direct care staff right out of college. Did that for 8-9 years, and I've worked with 7 CMHs across the state. You were right. But again, that's why we have the parent, guardian, and consumer satisfaction too. So whoever is, if they don't choose, and you were right, but if you recall, at least when I took consumers to the physician's office, whether it was, we carried these bags and had these 3-ring binders, because most of these folks were in institutions or had been in the program for many, many years, if not their whole life. And you had to carry all the 3-ring binders with you. And whether you went to the CMH psychiatrist on looking at a med reduction or anything, but you gave all of the staff, how the meds are doing, did they have a seizure, did they, all that kind of thing. But it was up to the staff, at least when I was in the group homes, to then give that information to the primary care. So I wanted to let you know that, Johnny's on Zoloft, or, that, and same with Children's Special Health Care Services, which years ago came into managed care. These parents would carry around all their information, and you may be in Grand Rapids for neurology and a heart doctor at U of M, and they had to make copies of everything and made sure all providers had that information. Currently, we are not getting any information from the CMHs, clinical information.
So you're telling me that CMHs don't have to put the information on my chart for physical and mental health care? Is that what you're telling me?
I'm not sure their responsibilities on my chart. All I know is our members, we have passed 2 pieces of legislation in my 20 years at this association that ask them to share information, clinical information, on the mental health side, and we have not yet to receive that. I think in the legislation they're looking at my head.
Further questions? I'm going to wander back a minute. So you're saying that a resident of Jackson County is going to have to pick a plan. Who's going to decide which plans are the ones eligible for Jackson? State of Michigan?
Yes, sir.
So the state of Michigan's going to choose 2 providers for Jackson. No more, no less.
More, at least 2.
At least 2.
Well, my experience with, and I hate to use this as an example, but my experience with road work is that amazingly enough, we ended up with only 2 providers in Jackson for road work, and they would ham and egg us regularly on the cost involved in that service. So my thought would be, since that's a business model that seems to work in road work, that why wouldn't it work in mental health? My other concern, we're going to cherry pick what customers they get to have. So if I'm on Zoloft and I'm running a business and I'm okay and I'm a low maintenance type operation, I'm going to be a gravy for a company. Whereas if I'm bipolar and I'm not taking my meds and I've chosen to self-medicate with the use of illicit drugs and alcohol and spend a lot of time on the street, who's going to take care of that person? Are you guys going to show up and take care of that person, or do I have to call the provider and have the provider come out and deal with those people? Who's going to have the arrangement and relationship with my sheriff's department that we currently have here in Jackson for mental health care and giving? Today, we've gone from people are bad, and we lock them up, and we'll sort them out, maybe, to no, we've arrested the person, we've picked him up, he's decided that, I didn't take my schizophrenic medicine, so the reason why you're arresting me is that I'm really schizophrenic. So instead of transporting him to the jail, we transport him to the hospital. We do an evaluation, we get him worked through, we get him back on his meds, we get him kind of more functional. He still broke the law, okay, and what he did, but now our component is go to care first, and then to the criminal punishment. Is your agency going to step up there and be with those patients? Or am I going to be on a 1-800 number to a call center to try to get this person taken care of?
Excellent question, and it's come up many times in committee hearings. And again, we have to and will contract with the CMH. This is one thing the sheriffs have been very vocal on, and you would still call your CMH. If that is the person they were like, I don't want to have 4 numbers I need to call if there's how many SIPs now, because now there's only one CMH. I know who to call. They have that relationship. We are not going to tarnish or change that relationship with your CMH whatsoever. And so that would all remain the same.
Any further questions? Okay, thank you.
Thank you.
Mary Beth?
Good morning, Commissioners. I do, if I might, present a packet of information for the Commissioners. May I bring them?
Entertain a motion to receive. All in favor?
Aye.
Those opposed? Duly carried. Would someone like these?
So I just want to point out it's for your ability to read, if you will, in your leisure as we prepare for meeting next week at the committee level. But it does provide information to you relative to our annual plan, a report for 2020 that shows the highlights relative to the financial status of where Lifeways ended in 2020, a lot of the outcomes relative to the services that we provide in our community, as well as some demographic information around people served and customer satisfaction. The other thing that's included in your packet is my presentation for today, as well as a handout you'll see that includes it's the most recent update from the Community Mental Health Association that identifies all of the individuals and organizations and associations that have come out in opposition of Senate Bills 597 and 598. So you all know me, and I'm here to kind of talk to you about the fact that before you, I have a resolution in requesting support from the county commissioners to oppose Senate Bills 597 and 598. I'll explain to you the stated purpose, which was kind of described by Christine and Brian today from the health plans for the stated purpose of the bills, what the current state of the community mental health system is related to the purpose, the importance of local-driven partnerships, and tell you why the county commissioners should be concerned about these bills. The Senate sponsors and the Michigan Association of the Health Plans have stated the purpose for the bills are several. One, to integrate the management of the behavioral and primary health care services. Two, to improve access to care, and also to provide customer choice. So let's look at each one of those individually, again, as it relates to the current system. The integration of the primary behavioral health to achieve improved care coordination. The current system, like they showed, for the Medicaid management of the primary health care and behavioral health care is split. You have primary care that is managed by the Medicaid health plans, and you have the management of behavioral health services managed by the prepaid inpatient health plans. There are 10 Medicaid health plans, and there are 10 prepaid inpatient health plans. Lifeways has had a vision, and I've been presenting to you as a county commission now for close to, I think it's been 10, 11 years. We've had a vision of integrated care. You have seen the evolution of your local community mental health over the last several years to achieve integrated care. We began our partnership, and we did that with a local partner here in Jackson, with the Federally Qualified Health Center, the Center for Family Health. We began that in 2011 and partnered with them to provide initially behavioral health services within the Federally Qualified Health Center. That has evolved, and many of you attended and participated in our ribbon-cutting ceremony, where we now have an integrated health clinic that is a partnership locally with our Federally Qualified Health Center. This partnership also occurred as part of a bond that you as county commissioners supported for Lifeways to be able to do the renovations necessary to truly provide behavioral health, primary care, and substance use together, holistically, for the populations that we serve. Since the clinic has been completed, we have served 172 individuals within the integrated health clinic, providing over 540 services, and that's just this year. Today, individuals in Jackson County can be served in an integrated delivery model. And this is occurring not just within Jackson County, in Hillsdale County, and your local Lifeways community mental health. It is happening across the state of Michigan. The second goal of stated purpose is around improved access. As a community mental health, the things that I see as the CEO, and I think I've shared this with you when I presented last month, when we talk about the challenges with people being able to access behavioral health, it is with those who have private commercial insurance, because they do not have the level of provider network, nor do they have the ability to access some of the specialty behavioral health services that your local public community mental health system can provide. In 2014, like many community mental healths across the state of Michigan, experienced a significant reduction in our general fund dollars. And when that happened, we had to look at those services that are unmandated, that to cut, because it was 69% of our funding. We went from $5 million to about 1.4. And at that time, one of the areas that we cut with services to our jails. And we had to do that. Again, we partnered with you, the county commission, around really looking at how can we address the issue of access to mental health care within our community. And what did we do? We, in partnership, pursued a mental health millage, the second in the state, to really look at meeting that gap. Also in 2014, Senator Debbie Stabenow passed the Mental Health and Excellence Act. The Mental Health and Excellence Act put and allowed for organizations like Lifeways to pursue what's called a certified community behavioral health clinic to obtain federal funding to allow for the implementation of integrated care across the nation. And that funding is through the Substance Abuse and Mental Health Administration. Lifeways strategically over the last several years have been working hard to be able to put into play the requirements as an organization to be able to apply and become a certified community behavioral health clinic. And I'm happy to announce that in February of this year, we were selected to become a certified community behavioral health clinic. Now let's look at allowing and improving choice. Lots of discussion just here recently about choice and about the fact that the community mental health does not allow choice in the current public system. And I argue that that is not a true statement. Currently, we have a provider network of over 70 providers with specialty services. Consumers do have a choice about accessing a variety of providers to provide the behavioral health services that they need. The other thing that's really important is because of the fact that we are now a certified community behavioral health clinic, it does allow for community mental health organizations to be able to provide services to people who are outside of our counties. So if somebody was from Lansing, Detroit, and they wanted to come to Lifeways to receive community behavioral health clinic services, they absolutely can. Partnerships. The importance of local partnerships cannot be understated about the concern that I have with this legislation. CMHs such as Lifeways, we are embedded in our local community where we develop partnerships based on our community's needs. The pursuit of the bond, the pursuit of the millage are examples of partnerships that happen as a result of being invested in our local community. We were also able to, as part of those partnerships, address issues like emergency room boarding that I've talked and shared with you over the last several years of challenges that we're experiencing around that and what we're doing to address that with our crisis services. Jail diversion partnerships, and most recently our partnerships with law enforcement to develop a co-response model. Our partnership with the county on the local mental health millages just this past year has allowed us the ability to serve in the jails 400 inmates, providing over 1,540 services. Also, we've been able to provide social enrichment program services for people with intellectual developmental disabilities through a program called Club Life. And they've been able to serve, just this past year, 120 individuals, even during the pandemic, in providing 1,500 services for individuals so that they can live an enriched life. We've provided 420 trauma services for over 100 students, and we've done that in partnership with behavioral health providers in our schools here in Jackson County. We have also provided 1,230 services this past year for the uninsured and the underinsured. Our partnership with the county also is around the capital improvement bond that we pursued and that you did in partnership on behalf of Lifeways to be able to do two major things. One, to really look at our community around crisis services and design a model that meets our community's needs. We have developed a crisis center that will provide a continuum of crisis services services that are alternatives to the emergency room board issue that we've talked about. This includes a crisis line, crisis screening and referral, 23-hour community living room, and mobile crisis services for both adults and children, as well as a crisis residential unit. What is at stake with these bills from the perspective of you as county commissioners? I will not stand up here, and I think I said this last time, I will not stand up here and say that our system is perfect. All systems have issues. And LifeWays, our experiences in the CMHs across the state of Michigan is around emergency room boarding. It's around the workforce challenges that are significant to pretty much all industries right now, but we are experiencing those same challenges, as well as the mental health needs of those individuals who touch first responders and law enforcement. Those are our significant challenges. However, LifeWays has the same goal. The goal that they've talked about relative to integrating care with primary care is absolutely a goal. I think if you look at the history and innovation of this organization and the partnership with the county demonstrates that we absolutely embrace integrated care. Why not invest with legislation to address the ongoing support of those integrated efforts? Why not support the system with a permanent, sustainable funding to treat mental health as primary health care is treated, and so that organizations like LifeWays isn't constantly chasing that almighty short-term limited grant? What remains at stake with these proposed bills is the local partnership and these collaborations. Senate Bills 597 and 598 do eliminate the current public mental health system. Edwards shared the exact language out of the current bills that talks about the fact that the management as it is currently with the county commission structure and the board structure of the CMH will dissolve after a period of time. Eliminating the CMH safety net role and giving that role to insurance health plan companies who really have no experience managing the severely mentally ill, or those with intellectual developmental disabilities, or those with substance use disorders. The health plans have not been able to demonstrate successful outcomes for the mild to moderate, which they currently do manage. In Hillsdale County, we experience this on a routine basis where enrollees with Medicaid are struggling to find, who are mild to moderate, who are struggling to be able to find psychiatrists or psychotherapy. Why you, as county commissioners, should be concerned. When was the last time you saw a health plan come to the table to address an issue that's being faced at our local community? The legislation would eliminate all local control and local decision-making. Senate Bill 598 specifically of the two bills will give our local mental health care decisions to out-of-state boards, mental health for-profit insurance companies, essentially allowing our mental health care decisions to be made potentially not even locally. Some are even out of state. The one question that I've asked and I still do not have an answer to that should be concerning to you as a county is what will happen to the investment by the county to partner with LifeWays in meeting the unique needs over the last several years. Why not build on the system that we have? The current system does need support in the areas that I've talked about of access to care, workforce challenges, emergency room boarding. Legislators should be addressing those needs and not creating legislation that changes just the financial integration. When you look at how many systems over time that have done financial integration and you look at models across the nation, they have failed. and it's going to be a struggle to put back a public mental health system. The governance and transparency is another issue that's concerning. Right now, you, as county commissioners, appoint the Lifeways Board. You are at the table relative to decision-makings at a local level. All meetings are open to the public under the Michigan Open Meetings Act. Private health insurance companies, on the other hand, are mostly firms located out of county, out of state potentially, and they are governed by owners without the connection at the local level. Their board meetings are not open to the public. One can learn by what has happened in other states, and we should take heed about those examples. Lifeways has 55 years of partnership with our county to provide mental health services. And we have done it with a dedicated board and support of this commission over the years. We were one of the first CMHs to deinstitutionalize individuals and believe that people deserved a right to live in our local communities. Our board has worked hard to strategically address the challenges that our community faces. And we have done it in partnership across a variety of stakeholders in this community. This integration and care coordination between primary care and mental health and substance use happens at the local level, not on a remote health plan. In closing, these bills, I believe, as your local CMH CEO, I believe, will dismantle our current public mental health system. Its provider network and the safety net that we currently provide for this community. Please consider supporting the resolution that's before you opposing Senate Bills 597 and 598. Our Jackson County taxpayers who are in need of mental health care would be wise to continue to support the public management in a partnership with our prepaid inpatient health plan and the CMHs that have the skills like Lifeways and experience as our community safety net, rather than the private health insurers who are seeking this role. And I thank you for your time, and I will open it up for questions.
Hello.
Hello.
Thanks for your presentation. Also, thank you for your work. In Jackson, mental illness and particularly substance abuse it affects our community greatly. They're some of the hardest individuals to work with, so I commend everybody who's out there on the front lines and trying to make a change.
Thank you.
I actually received a message from a resident in Jackson County, and I wanted to share it with you. And the reason for is this person could be completely off. I didn't really have a response for him. But when I hear the issue of choice in plans, I'm wondering if perhaps this issue that this person had would be resolved. So I'm just going to read to you word for word what they sent me, and it says, "Are you involved with Lifeways at all? I want to reach out to the directors. I'm pretty upset with that program. And think as a taxpayer, it's out of line that their psychiatrists will not help with ADHD at all. Like, what's up with that nonsense? I found it maybe they can explain to me how it's not important for people with ADHD to have services in Jackson County. I am quite upset about this and realize you're not on the board, but do want you to realize I am upset with this program as a taxpayer." I don't know if you would have a response for that individual. Is there services for ADHD?
There's absolutely services for ADHD, so I'm not sure. I mean, what I would like you to do, if you could send that to me so that I could do follow-up specifically with that individual. But absolutely, we provide services. That is.
Okay.
Yes.
Thank you. That's all I have.
Yeah.
All right.
Thank you, Mr. Chair. Thanks, Mary Beth, for being here today. Appreciate the exchange of ideas we've had. I think it's been worthwhile. I think one of the questions I asked the health plan folks was whether our community mental health agency could become a SIP under the legislation. Now, I know we're not excited about the legislation, but if it were to pass, could or would Lifeways be interested in being a SIP and or being a substantial contractor to a SIP, were that to be the case?
Well, there's two questions there. The first one about the SIP. So to be a specialty integrated plan, you have to have this risk reserve at the same level as the requirements of the health plans. And currently, statute in Michigan prevents a community mental health from having any type of risk reserve on the Medicaid side relative to that. When we have funds remaining at the end of the year, they are returned back to the prepaid inpatient health plan. And then which is the PIHP. The PIHP then has a limit relative to what they can maintain for risk reserve. It is nowhere near the level of a health plan, and which would be required under being a specialty integrated plan. Now, so Lifeways, no, we could never apply. The PIHP could never apply. They wouldn't have the reserves to be able to do that, wouldn't meet the definition. However, your second question relative to could Lifeways, absolutely Lifeways could pursue with whichever health plans in Jackson County, if they were selected, could whatever their procurement process, I don't know what it would look like, but we could enter into procuring a contract with that health plan.
So as an S3 substitute is being contemplated, I suppose the issues of the restrictions being put on you to gather capital might be worthwhile to deal with issues that may arise, okay, with objections that may arise to the bills on that particular topic.
If I can read between the line there, I think what I hear you saying is with that supplemental, if they were to structure it in such a way that would allow either a community mental health or a prepaid inpatient health plan to have the funds available so that they could pursue becoming a specialty integrated plan, that would be an interesting
potential.
Yes.
Potential, okay. I noticed also in the Senate Finance, Senate Fiscal analysis, something that's been discussed, I think, at board meetings at Lifeways for some time now, which is the encouragement or requirement that electronic inpatient psychiatric bed registry be put in place, which apparently is not, it's not there now.
They're working on it.
Yeah, but
5 years they've been working on it.
Yeah, that's, well, yeah, whenever I say I'm working on it to constituents, they kind of roll their eyes at me, and with good reason, I suppose. Okay, let's say that the bills were to be enacted. What would be Lifeways' reaction? What next to Lifeways? Let's say it's not a SIP. It's a what does Lifeways do? What does I should say a community mental health agency do generally? I think Lifeways is in a better place actually than most around the state. But what's next? What happens? And I think that's critical for us to know.
And I think there are a lot of there are a lot of unknowns relative to that. I think that the Lifeways board has always strategically had the mindset, and I appreciate a board like this, is to really design itself in such a way strategically that you can be the best community mental health in the state of Michigan, or you're prepared for what has always been, since 1997, a threat of privatization against the public mental health system. Obviously, I don't want to go that route, but if it happens, I believe that we are prepared and that we could apply and be a provider with a health plan. What I'm worried about isn't about the fact that we couldn't continue. Now, there may be changes relative to what the health plan is going to authorize for services. I worry about the impact, and I think I've shared that in a meeting just recently with all of you is about those individuals who I serve, who are very chronically ill, who cost a lot to the system, about what the health plan's decisions are going to be relative to providing ongoing care for those individuals. And then what will be the potential effect across the community relative to that. Where else might you see those individuals showing up when the CMH is not able to provide the level of care that we currently provide?
Good morning. I, for one, like the programs that you and your agency have been providing. I'm impressed and thankful that you do it. I intend to vote for your resolution and support it.
Thank you. Thank you.
Thank you, Mary Beth.
All right, thank you. I appreciate the time.
You bet. Other items to come before the board. I would like to take this opportunity to explain to the Board of Commissioners what we may have figured out as a pathway to replacement of Commissioner Mahoney. And get some input, make sure everybody's comfortable with what we're doing. We have 5 applicants that haven't received any others recently. We would have between now and Monday at 10 o'clock to possibly receive them. What I would like to do is at general government, I would like to be able to ask questions in an interview process with the people if they can make it. I realize that it's 10 o'clock in the morning, but if you're going to become a county commissioner, you need to make 10 o'clock meeting anyway. So I would hope they would be able to do that. My idea would be for commissioners to submit questions to the Administrator Controller's office, so that way they can be put together in a format and each person would be asked the same operational question. Now, that doesn't mean follow-up questions from a commissioner seated up here would not be different. That most certainly would be. So but I'm thinking that might be the process. And then Tuesday night, we would vote for the person to become the next county commissioner representing former Commissioner Mahoney's seat. That type of format would give us a chance to interview instead of trying to do it on Tuesday night, number one. Number two, it may give us a little bit more of a structure to comfort level with each person, being able to talk to them and get a good feeling for how they perceive their job, and we may be able to explain to them what their job is as a county commissioner and what you do. Thoughts from commissioners? Commissioner Bear.
Questions that we would submit to the administrator. I guess some questions I would ask every candidate, and some questions would be specific to each individual candidate based on what I saw in their application. I would prefer an approach where if we have the 5 candidates here, 4 of them are asked to leave the room.
We can't do that because of the Open Meetings Act. They are not, you can't do that.
Okay, so whoever goes first and is asked those general questions, everybody that follows has an advantage because they heard the question, they heard the answer, and
That could be, yes. But when we hired the Administrator Controller, we had them both sit in the room, and both of them had to put up with everything, and we ended up with Mr. Overton. So my belief is that the light of day is the best way to do things and not do things behind the scenes, if you would.
well, to me, part of the
I follow your
part
thought
of the light of
process.
day is that each person's answer is genuine and authentic, and not based on somebody else's answer.
Hopefully you can figure that out when you talk to a person. Commissioner Pulaski.
Well, I think Tony raises an excellent point, and to attempt to address that point, I think the issue is who goes first and who goes next. Perhaps some sort of random approach to who goes first and next might be arrived at.
Well,
Thank you,
the
Mr.
Board
Chair.
of Commissioners has a draw lots for when there is a tie in balloting, or has unfortunately or fortunately, Commissioner Hurl could have told you, we could cut the cards. I'm sure we can come up with a way, we can put their names in a hat, and draw a name out and let them start that way so it's random. Is everyone comfortable with that? My idea of coming here is to make sure we all are comfortable with what we're doing, not just showing up with an idea. Do we like that idea? Darius?
Very much appreciate this approach. It gives everyone the opportunity to hear and to the responses of all the individuals, and it gives the county commission the opportunity to vote based upon what everybody has heard. So I very much appreciate this approach.
Now, I do want to make commissioners aware that we function in a democracy. So that means a person could show up Tuesday night at 4:59 and apply for the job and could win the vote from the floor. It doesn't have to be one of the five. Okay? So everyone understands that. Say that. I'm just letting everyone know that there always is that possibility. I don't expect it to happen. I think that everybody will respect the system we're putting in place, and I really hope that this works well, because we've gone all different routes on selecting commissioners. Some have been agreed to be interims and just set in the seat until the election time. Others have wanted to run for the seat and have either been defeated or won, depending on what goes on. And I will tell you that I was selected from it and then had to run 4 times in 1 year for the job. So there is the possibility out there of that. Commissioner Kennedy.
Fine with the setup. Mike, what would you be comfortable with in getting the questions beforehand, and what date?
Friday's fine. Because you're talking about Tuesday at the committee, and that way I can share them.
Monday's committee.
Monday's committee, that's what I meant.
Share them over the weekend.
If I may just point out one other thing, in regard to process there, while we can't require that they leave the room, you can ask.
Yeah.
They don't have to, but you could ask, if you so choose.
So yes. Okay, so that's our consensus. I thank you, gentlemen, and being here. Tony?
Will each candidate be given an opportunity to just kind of make a opening statement?
Oh, sure.
Okay. To me, I'm a little hung up on this. Whoever goes first is at the worst advantage. Whoever goes last is at the strongest advantage. To balance that a little bit, can we draw names out of a hat to establish the order for making your opening statement, and then have a different order, draw names again for the question and answer period?
Sure.
That way you're not
Sure.
disadvantaged in 2 aspects, only one maybe.
Yeah. Corey and I like that idea, because Phil's got to do all the work, and he's not here. So yes, we can come up with whatever pathway we think is the best, and yeah, Tony, we can follow that. It'll only be our clerk that'll have to keep it sorted.
Thank you.
Yes. Okay, is there any other issues to come before the board? Yes. Yes, sir. We're under other business at this time. Tony, is your mic on? Thank you.
Sorry, I forget about that. I sent an email to the administrator, chair, and vice chair listing some of my concerns with our current real estate sales, how they're proceeding. I have a couple questions. I would like to see those addressed quickly, I can forward the email I sent to 3 of you to the other commissioners if you wish, or the administrator can forward them to everybody. My request is that our administrator is very, very knowledgeable about this whole system. I mean, he proposed it, advocated for it, put out the request for bids from different realtors, negotiated. So I have confidence in our administrator's intimate knowledge of this system. Therefore, my opinion, I think he should be able to answer these questions by our December 13th standing committee meetings. If not then, at least by our December 21st Board of Commissioners meeting. If it was somebody who wasn't familiar with this whole process, they would need more time. But my personal belief is he's so knowledgeable that he can give us a good response.
I believe the administrator controller would like to answer some of them now, and then others he will bring Monday morning. Mr. Overton.
Yeah, that's fine. I can answer what I can, and what I can't, we can do the homework and get a correct answer. First, a little overall view. You know, we had, I think, brought 20 properties roughly to the board, seeking approval to list them for sale. There are a few other additional properties that I know, like the Parks Board is looking at more closely on whether they can release the property for sale. So there might be some more coming down the road. We did go to bid for Realtor. We did bring that to the board. The board authorized Doug Beiswanger, I think I'm pronouncing it correctly. Beiswanger? Thank you. He received the bid, and we did enter into a 1-year contract with him, which means we have 1 year to make the sale, or close the sales, approve the sales with him. I know since that time that he has listed those properties in more than, I think, like about 50 different locations, Zillow and other places, I presume. I haven't gone to actually look. But he's listed them like he would any other properties. And we'll be showing the properties, accepting offers. I shouldn't say accepting offers, but receiving offers, because ultimately what will happen is, and what we've been thinking is, we would just save these offers up, and as at some predetermined time, and we haven't said when it'll be. Is it going to be 3 months from now? At some point, Doug will say, you know what, we've advertised, we've shown, we have multiple offers, or what have you on these properties. We would like to come to the board and seek approval for the highest offer. And he's been pretty forthright about it. Doug works for us. He does not work for the purchasers. He works for us. His interest is in getting the largest amount of money for each property for the county. I know he does, if you submit an offer of $25,000 and he already has an offer of 50, he'll just flat out tell you, well, I've got an offer of 50, you're going to have to do better than that, or else you're not even in the hunt, kind of thing, which is in our best interest. I have purchased multiple homes over my life, and I've been in the same situation to some degree on that sort of thing. We do want the most. It depends on whether your realtor works for you or works for someone else, and people get that confused sometimes. The purchaser may think the realtor works for him, but he doesn't. This person works for us and gets paid by the county. So at some point in time, within the 1 year, I'd like to think it'd be sooner than that, we would come to the board and say, here's the offers we have. And frankly, I've made it very clear that up until the board slams the gavel down and approves the vote, someone could make another offer. We want as much for as we can get for these properties. The realtor, like I said, visited the properties, help us determine value of the property, because what's a property's value? Well, it's what someone's willing to pay for it, and that is somewhat determined on the market and location, but the market is up now, and so he's been adding his, I think that's some of the added value the realtor brings, is understanding the market and the process and how to do all this. I know, Tony, you had asked about, I see, I'm looking at your email here, some questions in regard to us not knowing how much property we want to sell on a particular parcel or something. Well, that's not exactly correct. We do have, I can think of 2 parcels, where one of which we have like a tower that we use for JDOT. So we're going to sell the property, but not the tower, and not the easement that'll have to be created to that tower. Where the easement's going to be? Well, that's some negotiation between the owner, the county, and the purchaser. There's different directions you can come for an easement, depends on the nature of the property and, all that sort of thing in there or not, whether it's a wetland or this or that or so forth. So that'll all have to be worked out as with individual purchasers. Same thing with, I received a call from Howard Linneberry from Leone, and they have a lift station on one of the properties we want to sell. So, obviously, we're not going to sell their $500,000 lift station. There'll have to be an easement for that, and the rest of the property, though, we could sell. So we'll work that out, and that would be some negotiations with Leone. I did tell Howard, for what it's worth, you could buy the property, as well, if you'd like to make an offer on the property. But what other questions did you have?
Well, your responses helped me with my issues 2, 3, 4 that I listed. My issue 1, your response didn't adequately satisfy me. If we have a property and it's for sale, and the potential customer is asking what kind of easement is there going out to the tower, and the response from JC Dot is that, well, we don't know yet, and we don't know how much land we're really selling because we may want to retain some of that land for material storage. When these properties were first proposed to us, it was said that they have no value to us, that's why we're selling them. Well, now it appears it is of some value because they need to store materials there, and they don't know exactly how much that would be. So my question is, how does somebody put together a price, an offer to purchase, when they don't know the exact acreage that they are going to have control of? And why are we asking the realtor and the potential purchaser to negotiate on an easement? When I've bought homes, the easement was specified. It was in the previous owner's deed, or it was put on mine. So how do we not know what we need for easement? How did we not know how much land we needed to have for material storage? And until those are answers, how can somebody put a price together?
Well, first, I would reject your premise that we don't know. We do know how many acres a property is. Far as adding value, though,
do you know how many acres you are actually selling, or how many acres you are maintaining for material storage?
Yes, we do.
No, well,
I'm not sure
of a few
who
days
you're
ago,
talking to, but
JDOT did not know.
I'm talking to the director of JDOT, so any other employee you're speaking with has no bearing or
No,
clout.
this was from the director.
So she told you she doesn't know, to be clear, because I've talked to her, Tony, and that's not what I got from her. But regardless of that, we have worked through that with the former director. We have established it in our materials that we brought to the board and that you ultimately approved and allowed us to go to sell, or at least seek offers on. So, we have a good sense of what that is. Now, I would tell you that we could define an easement for that lift station or for that tower, but we potentially undercut the value or the maximum value on that property. It may very well be that the potential purchaser wants to do something quite different than what we have thought about and envisioned. We're not putting ourselves at a hindrance. We're actually enhancing the potential for value by working with the potential purchaser on what that easement should or should not be. I totally reject the premise that hurts the value. I think it actually enhances the value.
Okay. Well, her email stated the questions were, who owns the tower and what kind of easement is there? Her answer was, we own the tower. We will maintain access and probably a small portion of the property for material storage. Specific details have not been worked out yet. The realtor will be helping us with that.
Yeah, that would be material storage for the tower, would be my guess on that. As far as stone and gravel and salt,
Since we're still working it out.
Facilities for
So
that.
until it is worked out, I, as a potential purchaser, purchaser couldn't put in a price on it.
Well, then you could not as a purchaser, but I would assure you there are plenty of purchasers who would and be willing to work with us on what is the.
Don't demean me.
What is in, no, I'm just telling you straight up, it's a fact. You
I'm just
feel that
telling
way,
you
and you
that
could easily
the
do that.
details for this
But I'm
are
telling
not
you
worked out
as a-
yet. They should have been worked out 6 months ago.
Well, I disagree. I think that the way we are doing it will maximize the value on the property, working with the potential purchaser on what will be the best value. We could have done it your way and defined the easement and just said, this is it. Well, then the purchaser says, well, geez, I got this wetland issue. Could you go this way? Well, no, this is it. Well, that's not no way to do business, not if you want to maximize your value. And it doesn't take anything to draft up an easement when we decide we want to sell the property. So I would disagree
It
with that
takes
statement.
little effort to draft up an easement when we decide to sell a property. We decided to sell these properties at least 6 months ago.
You understand my position?
I don't support it.
I appreciate that.
Mr. Chair, can I call for point of order?
Yes, sir.
It seems as if this matter is going beyond the scope of this meeting, and if I am in order, can we move forward?
Yes, sir.
So, Commissioner Barry, you'll meet with the Administrator Controller and come to a conclusion, please? Did you hear what I asked? No, I'm asking you if you could meet with him on your own at another time. That's all. Okay. We have arrived at public comment guidelines. This is 2 minutes. The board to address the board, you may only address the board once under this public comment opportunity and may not yield your time to others. Board members may not debate or nor answer questions at this time.
I apologize. I walk funny these days. I'm a victim of back surgery in September, so I just want to take a quick minute and just let you guys know just how important this whole thing is to me as a person. I've grown up with mental illness. I was 8 years old when the sheriff came to my grandmother's house and told us that they took my uncle off the production floor at Goodyear for a nervous breakdown. That's what they called it back in those days. And he was put into Ypsilanti Regional. His son lived with us. His son ended up in Ypsilanti Regional before he died of a drug overdose. I have a close relative that's battling a heroin addiction right now. I have a mentally ill brother who's been a Lifeways consumer for 35 years, and I can't tell you I can't even describe what a blood-curdling scream sounds like when your sister calls you and tells you her son committed suicide. So, this is everything to me. I'm all in with this. But I just wanted to tell you, too, that you live in a PIHP that is not in a structural deficit, never has been. I've been the chair of that PIHP for 3 terms. I was re-elected to it while I was in the hospital, actually. And if 9 out of 10 tires fell off new Buicks, they try to find out why the tires are falling off instead of saying that the drivers were poor drivers.
Mr. Woods, 10 seconds.
I think these 9 PIHPs, we should be studying those, and Earl was looking for these kinds of solutions. Find out why they're in deficit situations, because they're all good CEOs and they're all good CFOs.
Thank you, sir.
So thank you.
Good morning, my name is Melissa Callison. I serve on the board at the Lifeways Committee on Mental Health, and also I'm an active member of several of its committees. I'm also the parent of an intellectually and developmentally disabled young man who receives services from the agency. And in the 2 minutes time, I could not anecdotally tell you all the issues I've had in navigating both the private healthcare plan sector as well as community mental health sector. But I will tell you that my concern, if these Senate bills were to pass, would be the inability for the proper advocacy for the people that we serve. I can't imagine any of those clients having to navigate a healthcare plan system to try to get the services they need. We need the local support of the CMHs. Thank you.
One of the things Peter Bormuth, I'm sorry. One of the things Earl probably knows better than I do are who the Senate supporters of this bill are and why they are pushing these two bills forward. Now, it's been something that's been in the works for at least 10 years, possibly, the way things operate up on Capitol Hill. But they're essentially people who are taking money from insurance companies. Let's be honest about that. I'd like to also speak in support of Lifeways. I feel like it's done a good job in this community. I feel like it's been innovative, and it's tried to work for the actual people who are there, on the ground that need those services. So the board has done a lot to work in partnership with Lifeways. They've trusted them with a millage, trusted them with a bond issue, and I'd like to see that trust repaid by passage of this resolution that's been asked for. Thank you.
Wow, we can follow Peter. Thank you. You guys got to cut me off earlier. When I was a commissioner, there was many times, that includes Chairman Shotwell, really wanted to cut me off, but he couldn't. But I got cut off this time. Anyway, I just wanted to say, listen, you've heard a lot here, and a lot of information from the private, the public, and so on and so forth. And I just want to say I appreciate your time. I appreciate you listening. This starts out a long day. And, when you look at the public mental health system, it's very important to keep in mind as you go through the committee process, keep in mind that the public mental health system is there to serve the people. It's not there to profit. It's not a for-profit, entity. Like the private healthcare company is. We're there to serve the people, and I just really want you to keep that in mind, please, as you go through the process. And I just, and I won't go into any of the details, but certainly I've had my struggles with some mental health issues as well as some of my family members. And I think a lot of us on this board that you actually appointed to be on the Lifeway board, we're involved in this because we care, and that's why you appointed us. And I just don't want that to be lost. And I really think that you've done a great job in appointing the people on there. And I've got 23 or 22 seconds. So again, I just want to say thank you very much. I really appreciate it. And the consumers, I can tell you this, I hear from the consumers because I'm on committees throughout the state. They look at the public mental health system as a lifeline. And to me, that says it all. Thank you.
Any other public comment? Public comment is now closed. Commissioner comments. Commissioner Kennedy.
Thank you, Mr. Chair. First, I'd like to thank you personally for the interview process that you came up with. I think it's excellent, I think it's fair, and I think it's transparent. And lastly, I'd just like to point out that Commissioner Bear and Mr. Bormuth were in agreement for the first time I've ever seen in my life.
Any other commissioner comments? Commissioner Pileski.
Thank you, Mr. Chair. I want to thank the board for listening to the presentations today. I think we're better educated and knowledgeable about the issues than we were before. And thanks to the folks from Lifeways for showing up this morning. I also like to echo, I think, Commissioner Snell's observation that we are looking for a building usage study of some sort before we get too far down the road of working on the various buildings around the county. Thank you, Mr. Chair.
Any other commissioners? Commissioner Snell.
Thank you, Mr. Chairman. There seems, one of the big things that I see with this mental health bill versus what we're doing now is administrative costs. And as Commissioner Pileski said, it's been like trying to, apples and oranges there, yeah. Challenging exactly what you said, but, for me, any increase in administrative costs is taking money away from those who need it the most. And that's one of the reasons we have a public mental health system, is that we can be assured that those that are working in that field are doing the best they can with the resources they have. And if this goes to a for-profit, then we have a profit motive. And I'm all for profit. I'm a realtor. I make my living on margins. So, but this isn't about profit. This is about taking care of the people who need it the most. So I hope to see this resolution on our agenda, and I'll certainly be voting for it in favor of Lifeways.
Any other commissioner comments? I want to thank Lifeways for coming. Our friends have left, so I guess we can't thank them for showing up, but I do appreciate it. Mr. Woods, as always, your counsel is very appreciative. Thank you, sir. With that, entertain a motion to adjourn. We have a motion and support. All in favor? Those opposed? Duly carried.